You're watching Fox 45 Morning News. All local, all morning.
Well, coming up, the World Health Organization estimates 3 to 4 million people in the Americas could be infected with the Zika virus in the next year. And now we know it can also be sexually transmitted. So what does that mean for us here in Maryland? We have an expert weighing in. 7:22 is the time. You're watching Fox 45 Morning News, all local, all morning.
The CDC and World Health Organizations, well, they've been very vocal about the influx of mosquito-spread disease known as Zika. We've all heard of it. Now we know the disease can be spread sexually, and it is confirmed here in the U.S. But what does that really mean for us? Dr. Darren Marinis, emergency medicine expert from MedStar Franklin Square Medical Center, is here to discuss the spread of this Zika virus. Good morning.
Yeah. Good morning. How are you doing?
I'm doing quite well. Now, we're reading about it. We're seeing the main thing that we see is we talk about pregnant women and their fetuses that may come out and they may have a disease because of the Zika virus. This is all coming out of Brazil. CDC has not defined, it's not definitive on if that is actually correlated.
Right, correct.
Okay.
So what we see coming out of Brazil is there's been an outbreak of Zika virus, which is a flavivirus carried by mosquitoes, the Aedes aegypti down there. And what we've seen is a spike, an increase in microcephalic babies, babies with small heads and developmental delay in the regions of Brazil that have had a lot of Zika virus in this past year.
What numbers? You said a spike. What are we talking about?
Well, typically in Brazil, there's about 150 to 200 cases in the whole country of microcephaly. And they have recorded 4,000 cases from March 2015 to January of 2016. So that's a huge 20-fold increase in microcephaly. Now, this is a very concerning. A couple of cases they've found Zika virus in the fetuses that have been microcephalic, and we do not have hard evidence proving that the Zika virus is causing this, but there's a very concerning trend, and it has resulted in the World Health Organization and the CDC recommending that people who are pregnant not travel to Zika endemic areas.
Until it's confirmed, though. I mean, they're saying, look, just as precaution, but this still has not been confirmed. I know there's some legal issues. Washington Times just released a story this morning that I was just reading about that said, you know what, it's legal issues on how much they can be released. What about, though, body fluids and spreading, and what would it mean here in the U.S. if it does? I mean, we know that it's saliva, blood, semen are the three main reasons behind it, a possible spread. And you'd think, as a layperson, mosquito lands on me, I'm infected, and goes and then, you know, hangs out with other mosquitoes. Next thing you know, it goes into the United States mosquito population.
Yeah, no, now sexual transmission has occurred in a case in Dallas 2 days ago, but it is not the predominant form in which this virus spreads, we think. It's a rare occurrence. So the most common way it spreads is somebody is infected with Zika, viremic, has the virus running around its blood, gets bitten by a mosquito, then that vector carries that to another individual who is also infected with the Zika virus. Now that is the standard way. Now the mosquito that spreads it is Aedes aegypti, which are a tropical mosquito. But one of the concerns is that we have temperate mosquitoes, Aedes albopictus, which can live all the way up to Chicago or New York during warm weather seasons. Our concern is that mosquito could be a vector for the virus too, eventually.
And one last thing, I know we have to go, we're out of time, but is the concern that that happens if you were walking around, would you even know that you have Zika virus if you were infected?
Well, 80% of people infected with Zika virus are asymptomatic. The 20% who are symptomatic usually have a mild fever and like some joint pain, a rash, and maybe conjunctivitis, red eyes. But it's very mild symptoms. And like I said, 80% are asymptomatic. So you may not even know that you have Zika virus. And the concern is really, lately, is the correlation or the association with microcephaly and intracranial calcifications that may...
That's the big scare.
Yeah, that may be caused by Zika virus, but we don't have hard evidence, as you say, yet, but it's a very concerning trend, and that's why the recommendations were made by the CDC and the World Health Organization.
Doctor, thank you so much. We appreciate that. Well, thank you very much for breaking that down for us. Well, coming up, Fog.